Greetings and welcome to our second lecture for psychiatric technician mental health nursing. We're going to look at, it's just a few slides here, and we're going to look at the difference between what we look at in substance abuse, DSHS regulations and ethics, professional ethics, and the laws and the ethics that may affect nursing type decisions. Nurses or psychic techs should be familiar with all state laws pertaining to nursing practice. And of course, for us in mental health, we have a set of standards, professional codes, and we also have the state health services laws. Now, one thing that you'll learn about in abnormal psychology is that involuntary commitment can be done in certain conditions. It must be done by a mastered level LPC or a psychiatrist signing off on it. It's when someone's hospitalized against their own will, and the reasoning would be, or the criteria is either they're a danger to themselves or others, if they're unable to provide for basic needs, or if they have some type of mental illness. If they're, when we go back to the last lecture on Maslow's hierarchy of needs, someone who's unable to function in a way to provide food or shelter. And like I've said in class before, 80% of Houston's homeless population has some type of mental illness or some type of mental health diagnosis. Now, some arguments against commitment. Of course, commitment hearings are often perfunctory. In other words, the thing that goes against human rights or someone's will. There are certain people who live on the streets and don't have a per se home like we would describe it by choice. And so there's a thing about someone's will to consent. The implicit promise of commitment is that the environment will be therapeutic, and this promise is not always kept. In other words, if you think back to, like I mentioned, One Flew Over the Cuckoo's Nest, or even Girl Interrupted, or even Shutter Island, some of the conditions, they're just basically being kept away from society instead of being therapeutically treated. Of course, coercion in mental health treatment does more harm than good. In other words, forcible treatment, and you'll see this with substance abuse as well. We talked about this as far as people being made to go to AA, that is seen by certain people to do more harm than good. And then, of course, commitment reinforces the stigma and can, if someone is committed against their will, then, that could be an automatic resistance to the therapy, and therefore render the therapy null and void or not as functioning. Also, most clients who are committed are economically disadvantaged and undereducated, so they really, have several, life factors set against them. And the process can be damage trust among family members. When I talk about the Quitman Clinic, I talk about many times family members drawing to an end or to a place to where they no longer had the capability to care for. If you've seen The Other Sister with Juliette Lewis, that's a similar situation where family members often come to an end, or if they're single, if there's a couple who has an only child and doesn't have extended family, then really their only choice is for some type of hospitalization or placement for their child. And I've seen this work in positives. I've seen some people with severe mental damage who are either had muscular dystrophy or had some type of other cognitive impairment that were placed into a rehabilitation center on a wing or a similar type of hospital or home setting where the family would visit and constantly be there through the process as much as possible. A lot of times work schedules in effective tools or facilities at home really leave the family with no choice other than to find an alternative care unit. The process Of course, outpatient commitment ignores the real issues because someone can go to clinic for 6 hours a day, but then where are you sending them afterwards? What does that really help them to do with severe mental illness? Also, there are some exceptions to confidentiality, and this is very similar to what we talk about in substance abuse. If the client's life is endangered, the client is a threat to public, or is there a compelling law enforcement need, then confidentiality can be broke. This is similar to domestic violence situations. If the client is a minor, elderly, or disabled, is thought to be a victim of abuse, what we mentioned with domestic violence. Disclosures that must be made to other professionals includes any type of reports of delusions about or any use of guns or weapons or thoughts of, impending thoughts of hurting someone or hurting themselves. And there is a duty to disclose. Now, if you look at the Tarasoff case out of California, in California, that case they are required to disclose. In other words, if a client comes to a session and says that when I leave here I'm going to harm someone, then you have a responsibility to notify the person and notify authorities if it's imminent danger. Now, in Texas, we're not a duty to warn state. In all cases, but we'll talk about that more as we go on in the semester. Competency is legal determination. Informed consent is related to competency. If someone is of sound mind and body, as evidenced by coherence, lack of anhedonia, or an ability to show a full range of motion, then they can consent to the treatment. And anytime that you have the ability to receive informed consent, then you should do so. Informed consent is crucial to treatment options and participation in research. And when someone consents to do treatment, there's a difference between have tos and want tos. If someone has to do something, then they're doing goals of someone else. That's why collaborative treatment planning is so important. Whereas if someone wants to do something, then they may actually have more of a willpower to the goals. Also, jails, prisons, and juvenile delinquent centers serve as alternatives to mental health treatment, and mentally ill individuals in correctional facilities are vulnerable to exploitation and abuse. Now, there is a wave of change in the field here in Harris County. Sheriff Adrian Garcia likes to describe that the largest mental health facility in the state is the Harris County Jail, and he's not exaggerating. And his platform as sheriff has been to utilize there are several abandoned buildings downtown, and they've already started to work on the tunnel system to utilize extra funds and buildings to have a mental health unit where all agencies citywide can come in and set up and be a part of it, so that people can be processed for mental illness instead of being housed there, and then instead of it being a rotating door, that they can be placed with a treatment provider, sent back to their community, and then get the services that they actually need, rather than just going through the criminal justice system. Some elements of ethical practice in nursing is the Code of Ethics for Nurses, which we'll review. We always want to know the Client Bill of Rights and the type of policies for disclosure and privacy practices, and then also advocacy. There's some resources here from the forensic nurses, psychiatric advice, and then the nursing ethics. Definitely click on this nursing ethics. A lot of your questions for the quiz will come from this lecture, as well as reading the articles on nursing ethics. This concludes our second lecture, and I will see you in the next lecture.